I want to start this video by asking you a very direct question. Have you ever heard of Tadalafil? This little pill that many people call the modern cousin of Viagra is one of the most prescribed drugs in the world for treating erectile dysfunction. It promises to improve erection firmness, boost confidence in intimate moments, and even help with certain urinary symptoms. But does it really work for everyone? What are the side effects? Is there a correct dose for each man? And can it cause dependence? If you've used it, want to use it, or simply want to better understand this topic that involves health, self-esteem, and quality of life, stay with me until the end because I'll explain everything you need to know about Tadalafil clearly and without unnecessary complications. I'm Dr. Ashley Collins, a physician with over 20 years of experience in men's health and a specialist in clinical nutrition. Throughout my career, I've helped hundreds of men regain not only their sexual health, but also their confidence, energy, and vitality to live well. Before we start, make sure to subscribe to the channel, turn on the notification bell, and leave your like because this content can transform not just your life, but the lives of thousands of men who need this information. Now that you know what we're going to talk about, let's get straight to the point. What exactly is Tadalafil? Tadalafil is a medication from the same family as Viagra, but considered a more modern version. It belongs to a class of drugs called phosphodiesterase type 5 inhibitors, PED5, which work by improving blood flow to the penis. Its mechanism increases the concentration of a substance called cyclic GMP, responsible for relaxing blood vessels and allowing blood to fill the corpora cavernosa, resulting in a firmer and longer-lasting erection. It's important to understand that Tadalafil does not create an automatic erection. It simply enhances the body's natural response, helping men react better to sexual stimulation. It acts as a support for the physiological process, but it does not replace desire or arousal. After being ingested, Tadalafil begins to act in about 30 minutes. The peak effect usually occurs around 3 hours, and its action can last up to 17 hours. This extended duration is one of its biggest advantages since it allows for more freedom and reduces anxiety related to timing sexual activity. In clinical practice, Tadalafil can be used in 2 ways: daily doses or as needed. The 5 milligrams version is typically prescribed for continuous use, especially for men with frequent sexual activity or those who also experience urinary symptoms related to the prostate. The 20 milligrams version is generally used only when sexual activity is expected. Additionally, compounding pharmacies offer personalized alternatives such as intermediate doses, sublingual tablets, fast-absorbing sprays, and even implants combined with testosterone. The method of use should always be defined under medical supervision, as not all patients respond in the same way. What works for one may not work for another. Finally, it's essential to reinforce that Tadalafil only works when there is sexual stimulation. Without desire or arousal, the medication will not cause an erection. Tadalafil is best known for treating erectile dysfunction, but that's not its only indication. It was developed to help men regain erection quality, ensuring firmness and duration during intercourse. However, clinical practice has shown that the drug can be useful in other contexts. One example is premature ejaculation linked to anxiety about maintaining an erection. Many men ejaculate quickly because they fear losing firmness. In such cases, when erectile dysfunction is the underlying issue, Tadalafil can be used alongside other therapies to prolong time before ejaculation. Another important use is for urinary symptoms caused by benign prostatic hyperplasia, also known as an enlarged prostate. In these cases, daily use of low doses, usually 5 milligrams, can improve urinary flow and reduce symptoms such as weak stream, difficulty starting urination, and frequent nighttime urination. In recent years, a non-medical use has emerged that requires caution: the use of Tadalafil in gyms to allegedly enhance physical performance. This is not recommended and can be risky. The drug was not designed for that purpose, does not improve athletic performance, and may create a false sense of benefit as well as tolerance over time. Therefore, while Tadalafil is a valuable tool, its use must always be guided by a physician. Correct use brings real benefits, while improper use can cause side effects and compromise future treatment effectiveness. If this content made sense to you, leave your guste, so that more people can be reached with this vital information. Determining the correct dose of Tadalafil depends on the patient's profile and the treatment goal. Generally, there are two main ways to use it: daily. Low-dose use or higher doses as needed. The 5 mg daily dose is recommended for men with more frequent sexual activity or those who also suffer from urinary symptoms related to benign prostatic enlargement. This schedule has the advantage of keeping the medication at a steady concentration in the body, allowing more spontaneity in sexual activity without needing to plan the timing. The 20 mg dose, on the other hand, is the most common for occasional use, typically taken 30 minutes to 1 hour before sexual activity. This is best for men with less frequent intercourse or those who prefer not to take medication every day. Its effects can last up to 17 hours, providing flexibility and avoiding pressure to perform at a specific moment. There are also intermediate compounded doses available, such as 2.5 mg capsules that can be adjusted according to individual tolerance and needs. Sublingual tablets or sprays are also sometimes used for faster absorption, though not suitable for everyone. As with any medication, Tadalafil can cause side effects, though not everyone experiences them. The most common are headache, facial flushing, nasal congestion, heartburn, and muscle pain, especially in the lower back and legs. These effects are usually mild and temporary, fading as the body adjusts. Some men may report slight visual disturbances such as difficulty distinguishing colors, though this is rarer with Tadalafil than with other drugs of the same class. Another possible effect is a drop in blood pressure, particularly when combined with vasodilating substances. That's why medical guidance is always essential. Have you ever experienced side effects from a medication that made you question its use? What was your experience? Contraindications must be taken very seriously. The main one is concurrent use with nitrate-based medications, often prescribed for heart conditions. The combination can cause a severe drop in blood pressure, posing life-threatening risks. Tadalafil is also contraindicated in men with unstable cardiovascular disease, recent heart attack or stroke, severe liver failure, or advanced kidney disease. Those already using other erectile dysfunction medications must also be cautious, as combining them does not increase benefits and may intensify risks. Using Tadalafil recreationally or without medical supervision can lead to misuse and undesirable side effects. In summary, side effects are usually manageable, but contraindications require strict attention. Medical monitoring ensures safety and helps determine the correct dose and usage method for each patient. Daily Tadalafil use, especially at 5 mg, has become increasingly common. When properly indicated, it can bring significant benefits, maintaining consistent blood levels, promoting spontaneous sexual life, and helping manage urinary symptoms in men with benign prostatic hyperplasia. For many patients, this eliminates the need to schedule sexual activity around medication, reducing anxiety and allowing for a more natural experience. However, not everyone benefits from this routine. Men with infrequent sexual activity may find no advantage in taking it daily. Continuous use also increases exposure to side effects, even if mild. The decision to use Tadalafil continuously must always be individualized. The physician assesses sexual frequency, overall health, tolerance, and expectations. When properly prescribed, it can improve not only erectile function, but also overall quality of life. After everything we've discussed, it's clear that Tadalafil is a powerful tool when used correctly, but it requires proper guidance and responsibility. It's not a magic pill that solves everything overnight. It works as part of a broader picture that includes physical, emotional, and relational health. Every body reacts differently. Two men can take the same dose and have completely different outcomes. While one may see rapid improvement, another might notice little change. That doesn't mean the drug is ineffective. It means that health conditions, habits, and psychological factors directly influence results. Tadalafil also doesn't replace overall self-care. It can improve erections, but it won't fix circulation problems caused by smoking, lack of exercise, or poor diet. In such cases, it acts as a patch, not a solution. That's why I always emphasize, if you truly want to regain potency, energy, and confidence, you must take care of your lifestyle. Regular physical activity, balanced, Nutrition, proper sleep, and stress management can enhance the medication's effects and sometimes even reduce the need for it. Emotional health is also crucial. Many men develop a psychological dependence on Tadalafil, not chemical but mental. They begin to believe they can't perform sexually without it, which damages self-confidence and increases anxiety. That's why I always recommend combining medical treatment with broader strategies such as psychotherapy, sex therapy, or even vacuum devices, when appropriate. It's also important to highlight transparency between doctor and patient. Many men feel embarrassed to discuss sexual difficulties and end up self-medicating, often buying drugs of dubious origin online. Only a qualified professional can properly diagnose the cause of erectile dysfunction and recommend the right treatment, whether it's Tadalafil or other approaches. What is the one lifestyle change you are willing to commit to today to improve your overall health, beyond taking a pill? Finally, I want to leave an essential message. Sexuality is part of health and deserves to be cared for seriously. Seeking help is not a sign of weakness. It's a sign of responsibility and self-respect. Tadalafil can be a great ally, but it must be part of a larger plan to restore vitality, self-esteem, and quality of life. Leave a comment below and tell me what you would do to improve your overall health. And please let me know where you are watching from. Your participation is very important to us. If this content made sense to you, share it with someone who could benefit from it. And remember, always seek medical guidance when needed, and never give up on living with health, energy, and pleasure. Take good care of yourselves, and I'll see you in the next video.